Good evening. Welcome to BW Wellbeing of BW Business World on the Mind, Body, Soul show. Today we have a very special guest with us, Dr. K.R. Balakrishnan, Chairman, Cardiac Sciences Director, Institute of Heart and Lung Transplant and Mechanical Circulatory Support, MGM Healthcare. Dr. Balakrishnan is known for his evidence-based approach to healthcare practices and refined clinical expertise in surgery. His areas of expertise include end-stage heart failure management, heart transplant and VAD implant, pediatric cardiac surgery, lung transplant, and heart and lung transplant. He has received numerous awards for his work, and his work has been published in some of the highest ranking medical journals. Welcome, sir.
Thank you. Good evening.
Good evening, sir. Sir, my first question to you would be how have the last 7 months been for you?
It's a nightmare.
Yes, sir.
I think it's like a world war. This virus is nothing like we have ever known before. And every day we are discovering new facets to its manifestation. I still don't think we know how to treat it. A lot of anecdotal and conjectural therapies with which people come out, make a big noise, and then it's proven that it's no longer effective. While a large number of people are recovering, a lot of people have died, unfortunately, and continuing to do so. Even if you say that the percentage of people who have recovered is much higher than those who have died, a small percentage in a country of 1.4 billion people is a very large number of actual people. As a consequence, we are inundated with patients who are very sick. And advanced facilities in terms of intensive care and further therapy, unfortunately, is not widely available in this country. So all of them flock to tertiary care hospitals, which frankly don't have enough. We've never had so many patients requiring advanced treatment like ECMO or other things. So it's a crisis. I think it's almost like a world war. I hope this shall pass.
Okay, sir. Sir, do you believe there's a need for change in our current life when it comes to our heart health?
Yes. Modern life, with all its trappings of comfort and remote control of virtually everything in our lives, has a downside to it, which is that getting exercise is now something that we have to do as not as a matter of life, but as a time set aside in a busy day while we're pursuing something else. As a consequence, especially now with so many restrictions and people are afraid to go out because of the risk of catching disease, and most of the gymnasiums are closed, and rightly so. The avenues for exercise for everyone may not be the same. A lot of people live in small flats which are crowded, streets are crowded. So yes, there is a problem, at least for the last several months, with so much of lockdown, with the ability to do the kind of exercise that we were doing before all this happened.
Fantastic, sir. So, what are some heart issues that have worsened amidst COVID?
You know, it's a strange question. The number of patients getting admitted with a heart attack, and as a consequence, the number of patients getting admitted for procedures of the heart, like angioplasty or coronary bypass surgery, has come down significantly in most hospitals, not only in this country, but across the world. It's difficult to know whether that's been an actual decrease in incidence, or there's a greater reluctance on the part of patients to seek help or get to hospitals which they know are full of patients with COVID. So they might wish to take their chances with the disease rather than risk getting an infection for which no known treatment exists. This is a fact. Number two is I'm personally not convinced that the actual incidence of disease has come down as some people have claimed. Number two, and so it's very likely that the number of people coming to seek attention is less. I know for a fact from several examples in my own practice that when patients get chest pain, very often hospitals are reluctant to admit them right away and insist on one or two COVID tests being negative. As a consequence, a very significant amount of time is wasted waiting for those results. As a consequence, those who actually have a heart attack become sicker and lose a significant amount of time, and as a consequence, some amount of heart muscle. And the end result is the heart attack leaves them with more damage than they would otherwise have had if COVID didn't exist.
Okay, sir.
And some of these deaths which happen at home, uh, in the absence of autopsies, we don't know whether it was a heart attack, which they didn't seek attention. We also have anecdotal evidence of sudden deaths increasingly occurring in patients who have COVID because this disease seems to affect blood vessels in such a way that blood vessels seem to form clot formation. So
Yes,
it's multifactorial. I think there is a significant amount of silent deaths which are not accounted for as a consequence of heart attacks, which are not necessarily diagnosed.
okay, sir. Sir, just a request, if you could lift your camera a bit because I can. Yes, sir. Now it's fine, sir. Thank you, sir. So I wanted to ask you something. You achieved so much, yet you're humble. How do you inculcate this humility?
Who says, I don't know. What is that to be?
No, sir. The way you come across, a lot of humility.
Humility is there because I don't think we know very much about most things. In a strange way, I feel that the older you get, the more you realize that there is so much you don't know. I think most of us tend to be cockier when we are 30 than
Yes.
when we are 60, whether that's age or wisdom or the realization that you don't have answers to everything, and whatever you thought were the greatest answers turned out to be not so true at all. So all of us are, again, this is not a philosophical statement, but I sincerely believe what I say is true. We are just passengers in this ship called life for brief periods
Yes, sir.
of time. I think that's something all of us, the mightiest and the strongest, everyone turns to dust. So as long as we remember that and try to do our small two bits to help other people, I think that would be one way, I think, which is a sensible way of living.
Okay, sir. So I request you to put the camera in the same. Yes, it keeps going down. Yes, sir. Thank you, sir. Sir, I wanted to ask you, there are many young adults, like maybe from the age between 30 to 40, and they actually follow a very good, healthy regime, a discipline, balanced diet, everything that's required for their well-being, but they still do get heart attacks at times.
Yes,
So what would be the cause of this, or
there
what could
is a genetic component. I think I've come to the conclusion that apart from lifestyle and everything else,
yes, sir.
um, the genetic predisposition to getting coronary artery disease is a very strong trait. So if you have a family history of heart disease, you have a significantly higher probability of getting heart disease than if you didn't. While the well-known risk factors of diabetes, hypertension, smoking, lack of exercise, and cholesterol are known and are modifiable. Um, it's also a fact that there are people who indulge in all this and don't get disease, and there are people who are strict about every possible control of their body metabolism that is possible, and yet um, so there is a genetic component which is important. Some of that is increasingly being understood. But nevertheless, no matter what your inherent risk factor for getting heart disease, that means you come from a family where your father or grandfather, your uncles have had history of heart attacks. It's possible to decrease the risk of you getting it if you were to follow these guidelines of secondary prevention, primary
Okay, so
prevention.
sometimes like I just wanted to ask you that do you believe that a sedentary life impacts our heart and leaves a permanent mark on it?
Oh yes, the there are people at the age of 60 who look like they're 40, and there are, of course, I see every day patients who are 45 who look like they're 75. So there is a physical age and there is a biological age.
Yes.
To a large extent, it's decided by how you use the body that you're born with and look after it well. Most of us, and that includes me, would spend more time looking after our favorite car or favorite music system than we look after our own body, unfortunately, without realizing that the most valuable asset we possess is our health. It sounds like a cliche, and most people would laugh at it till you realize how important it is only when you don't have it. Uh, so it's something that we need to set aside a fixed amount of time every day or every week because nobody cares about your health as much as you should.
Yes. Sir, do you feel that young adults also stretch their limits when it comes to exercise or maybe playing soccer or just any indulging in any very high intensity uh,
There is a
sports?
well-known risk of, especially those with underlying, um, some of these things that you hear about of people falling dead in the soccer field or in the marathon
Yes,
might have an underlying undetected disease of the heart called hypertrophic cardiomyopathy. Sometimes when you have strenuous exercise or long distance training or other things, your heart muscle has to get thickened for you to be able to sustain the kind of physical activity that your body is demanding of it. And sometimes it's not easy to distinguish between a thickened heart muscle, which is a physiological demand of the body because it's being subjected to so much exercise, versus pathological hypertrophy, which occurs as a consequence of disease. So every once in 2 years, you hear a story of a footballer falling dead in the middle
yes,
of a
sir.
soccer field while playing a game. So there is now increasing awareness about this entity, and especially if they have had some kind of symptoms, chest pain or anything else while doing strenuous exercise, they have to be investigated. Unfortunately, because of lack of awareness, a lot of young people think admitting to symptoms of this kind is a sign of weakness and don't necessarily seek help, which might save their lives when they should. So, no symptom like that should ever be ignored.
Okay, so. So, how have recent technological advancements been able to help to manage these conditions?
Even one of the technological advances that, aside from the ones which are um, in the domain of hospitals and specialists, some of the advances that we have now seen, including the smart watches, which are able to measure an electrocardiogram, for instance, and pick up disorders of rhythm, I think are useful innovations. Um, what we have today is better than what was available 5 years ago. But I think that space would become more sophisticated. And wearables, in terms of being able to detect rhythm disturbances, would get more and more sophisticated. So that if someone were to um, suddenly have a ventricular fibrillation and drop dead, Not only might your phone be able to call the next of kin or your closest hospital, but in future I might even think that it might be able to deliver a shot. Um, Technology certainly exists. It's a matter of miniaturizing it and making it adaptable for large scale utilization. One of the issues is not that it might work in a field in controlled circumstances, but in a crowded, real day-to-day workplace, uh, how do you deal with false alarms and signals which may or may not necessarily mean what they do? So there's still work needs to be done, but I think that space would get more sophisticated in the coming decades.
Okay, so what are some precautions we should follow for good heart health?
Everyone knows precautions. The problem is not knowing them. Problem is following them.
Yes, sir.
Yes. What I'm going to say is being repeated ad nauseum. Follow a sensible diet, uh, cut down the amount of salt you take, stop smoking, drink in moderation, and have regular exercise. Um, the problem is, as some cynics have said, if you do all this, what the hell is the point in living? So, uh, real life is what it is. But it's certainly possible to do things in moderation. And if you develop a habit of getting exercise regularly right from early youth, that habit sticks. So I think regular physical activity is one of the simplest things to follow.
Okay, so my last question to you before you give a message to our viewers. Uh, how has the current pandemic affected the number of heart failure patients in our country due to maybe anxiety or fear?
The heart failure is an epidemic now for a number of reasons. People are living longer, so as you live longer, your the true incidence of heart failure surfaces because if you're going to get heart failure at the age of 65, but you died at the age of 40 or 35 because of other infectious disease and other things, this would not have been noticed. So the number of patients with heart failure has gone up uh, significantly compared to 15 to 20 years ago. At the same time, the drugs available to treat them and devices, including artificial heart pumps, have also become much more sophisticated and more widely available. The strange thing, this relationship between treatment available and disease is that both of them are constantly at loggerheads, and the more we try to come up with solutions for a disease, the more nature comes up with other disease conditions which require you to be even more innovative. So that's the nature of things.
So, what would your message be to our viewers, to the young adults, to elderly people
My
during these
message,
times?
my message to young adults is youth is not going to last forever, but good health can be. So look at the beauty of your organs inside, your heart or your lungs, rather than the way you look, because the beauty of your heart may not be seen outside, but that's going to last much longer and enable you to reach the age of 80 or 90 without seeing the inside of hospitals.
So, and for the elderly to remain
For
fit.
the elderly, no matter how or long you live an active life. Life is meant to be enjoyed and savored every minute of your time on this earth. So, um, uh, having a positive outlook and exercising regularly will go a long way towards keeping old age at bay. Elderly doesn't mean you have to be uh, saddled with old age. They're different things. Your physical age can be any number, but you can be fairly youthful in terms of your biological age.
Okay, so thank you so much. I don't have any other questions. If you would like to add something.
No, I'm fine. I hope it was
Okay,
You
sir.
think someone would be interested to listen to such this kind of story? I doubt it.
No, sir, you spoke really well, and we are very grateful for you to take out time for us. And it was really insightful. Thank you so much, sir.
Welcome. Thank you. Bye bye.
Bye bye, sir.